Here's how to use the Steroburn Burn Kit. This person has burnt their forearm. The first thing we're going to do is put on our nitrile gloves. Inspect the area that they've burnt. If we need to wash away any contaminants, we can do this using the sterile pods. Twist off the cap off one of the pods and gently irrigate the area to clean any debris. So there are different sizes of burns dressings. For this one, because it's a forearm, I've chose this side. So tear off the top of the burns dressing, and inside is a dressing that is soaked in a gel. This is sterile, so it can be placed directly on the wound, and this can now be covered with a bandage or cling film to secure it in place. So now we can open our bandage, and like we would bandage anything else, just to secure this dressing in place, slightly pulling and stretching, but not too much, because what's going to happen with a burn is it's most likely going to swell. Doing our normal 50% overlap from the elbow down to the wrist. So securing the bandage into position using some microporous tape. If a burn has affected somebody's hands, feet, face or near their face or their genitals, they need to seek urgent medical attention.